Hi everyone, welcome to Pinoy Nurse Portal. It's been a while since I've vlogged. If you're new here, welcome. And if you've been here before, welcome back. This is your nurse, Rebecca. In today's episode, we will talk about discharging a patient. Yes, Rebecca, that's a boring topic, but no, it's not. If you want to be a future USRN, these are things that you need to learn, because in the United States, when you are discharging a patient, they don't just go home. That's not the only option. They can go to hospice, to a shelter, to a sniff, and they can go home with home health. Okay, there are a lot of nursing responsibilities that you need to know when discharging a patient. So if you are interested, please stick around. All right, so you got an order from the doctor to discharge a patient. Okay, so the doctor's order might say discharge patient home. All right, so that's the most simple type of discharge, just discharging patient home. So your nursing responsibility is to educate the patient, educate the family, and to remove their IV. Make sure they have a transport, meaning a person to pick them up. If they don't have a transport, you could call a taxi or a transportation through their insurance. That's why when you are admitting a patient, the patient will have a face sheet, okay, that is printed upon admission. A face sheet will include the patient's information and the patient's insurance information. On that insurance information, it will have a number to call for a transport if they don't have a person to pick them up. Okay, next, discharging a patient to a shelter. So what is a shelter? Shelter basically is a shelter for homeless people. Okay, so the patients who live in the street, they can go to a shelter. But can they choose not to go to a shelter? The answer is yes. Most patients don't actually go to the shelter. I don't know why. Maybe there are restrictions or something, but the patient, most of them, they just want to be discharged on the street. Can you do that in our facility? Yes. Okay, because they are homeless, they can go back to the street, but it doesn't mean you will not give them a patient education. You still have to educate them, and whether they will do the education or follow the education you've given them, it doesn't matter, as long as you do your job as the nurse. Okay, so your nursing responsibility when discharging patient to a shelter, actually it's the same. You just give them education, remove the IV, and it's the case manager or the case management who will look for a shelter for that patient. Usually the case management will write it on their note on the patient's chart, the list of shelters that the patient can go. All right, so it's either you or the case management can ask the patient, and the patient can make a choice. The patient can decline, and that's okay. All right, next, let's talk about discharging a patient to a hospice facility. So what is hospice? This is a place for patients whose prognosis is not looking good, and this is for the patients that do not want to be resuscitated anymore. So usually they are DNR or DNI. Okay, so does that mean that the patient will not get treatment, like for example antibiotic, IV fluids, or nutrition when they go to a hospice facility? The answer is it depends. Okay, some relatives or some patients that are conscious can still choose to continue with their nutrition and IV fluids, even antibiotics. So in that case, your nursing responsibility is to make sure that the IV is still patent. Next, if they want to continue with their nutrition, make sure that the PEG tube or the duo tube is patent. Okay, but most patients, when they are brought to hospice, they are unconscious. Then they are basically for comfort measures only. They are given Ativan and morphine round the clock. Can the patient go home with hospice? The answer is yes. Some patients or relatives do not want their loved ones to go to a hospice facility. They want them to go home with hospice care, which means a nurse can go to that house. For example, they need oxygen, they need a pump for their tube feed. Okay, all of this will be arranged by the case management. Okay, so what's your nursing responsibility when discharging a patient to home with hospice is to make sure that everything the patient needs at home will be available, like the oxygen, the feeding pump, or the IV pump if they still need IV fluids or IV antibiotics. Okay, so your question might be, so the patient's prognosis is not looking good, so why does the patient still have IV antibiotic? Well, it depends, like I said, on the decision of their relatives. Okay, it doesn't mean they don't need care when they are, in that stage of their life. Okay, they still need care, they still need treatment, and it all depends on the decision of the patient. And another thing is, it depends on the insurance of the patient. Next, discharging a patient to a group home. So what's the difference between a shelter and a group home? Shelter is for people that are homeless. Group home is basically a home managed by someone with a medical background, usually, and or if not managed by someone with medical background, they have to have someone that has a medical background affiliated to that group home. Like, for example, I'm a nurse and I want to start my own business. I want to have a group home. Well, I don't know the whole process, but I know some people that are nurses who are running a group home. Okay, and you can admit your patients, and it's basically, you could, like, I can convert this house into a group home, but a two-story house will not be advisable because most of your patients are elderly and they are recovering and they don't have relatives to care for them. Okay, so a group home, I don't know how many maximum patients a group home can accommodate. So what's the setup like in a group home, and how is it different from a sniff or a shelter? In a group home, they will have a caregiver. The caregiver will help the patients with their medication. They will make sure that they have it and they are taking the right dose. The patient can have their medications at their bedside. Next, they will help them with their hygiene, preparing their meals. So the group home will provide the meals for the patient: breakfast, lunch, dinner, and 2 snacks, I think. And they will also help them with their doctor's appointment and doctor's follow-up. They don't have IVs anymore. They don't need that in a group home. So what's the difference with the sniff? Okay, so sniff, basically skilled nursing facility, they need nurses there. The group home, they don't have a nurse, but although it has to be owned or operated by someone, it could be a nurse or someone with medical background, but the nurse doesn't have to work there, like physically take care of the people in the group home. A caretaker, a caregiver can be there. So the caregiver has to have at least, I think, BLS for them to work as a caregiver in a group home. Next, discharging a patient to a sniff, and how is it different from a group home? Sniff or SNF stands for skilled nursing facility. It means that the patient is good to be discharged from a hospital, but not too well yet to be discharged home. Meaning they still need something medically or physically or psychologically, need something that only a sniff or a skilled nursing facility can offer. For example, they still need antibiotic for patients that have for patients that have osteomyelitis, they will need long-term antibiotic treatment. Usually patients are discharged with a PICC line. Okay, PICC line stands for peripherally inserted central catheter. Okay, it looks like this, and your nursing responsibility is to make sure it's working. Next, discharging a patient home with home health. What does that mean, Nurse Rebecca? The patient is going home but with home health care. Can all patients go home with home health? The answer is no, because the patient needs to have a good insurance, and the insurance has to approve that patient's need. Some patient cannot go home with home health. It depends on their insurance, but they can go to a sniff. Okay, so it really depends on the type of insurance. So what does home health do? The patient can go home with home health for wound care, for antibiotic treatment, for tube feeding, meaning to say these are the cases that the nurse will just go visit the patient. So future USRNs, this could be one of a good side job if you become a future USRN. Okay, you could be a home health nurse. You will just visit the patient in their home, and let's say, for example, but this is not a 9 to 5 job or a 12-hour job. Okay, you are paid per hour, and let's say, for example, you saw the patient for an IV antibiotic and you are paid $50 an hour. That's just an example, and you only stayed there for 15 minutes. You will still be paid like the full 1 hour. Okay, you will still be paid $50 for that visit. Next, discharging a patient home with equipment. For example, the patient needs home oxygen, a walker, a wheelchair, a hospital bed, or a shower chair. Your nursing responsibility is to make sure, okay, that before sending them out of the hospital door, that all these equipments are available in their home, especially the oxygen. Don't send a patient home without the oxygen. Well, usually the oxygen tank is delivered in the hospital, but they will have the portable tank. Make sure that they already have another tank in their home when they arrive. Oh my God, don't make a mistake. They go home, they don't have a reserve. Okay, next, shower chair that can wait. For example, you are discharging a patient on a weekend or on a Saturday. I said weekend, Saturday. What's the difference? Yeah, they're the same. So sometimes when you're discharging patients on a weekend, those equipments will not be available till the next business day, which is Monday. So it depends. If the patient said, no, I will not go home without my wheelchair home, or I don't want to go home without my walker, well, you can talk to the doctor, tell them the patient does not want to go home. They can delay the discharge, or they can still send them home. It really depends on the situation. Okay, next, discharging a patient to a correctional facility, which means the jail or the prison. This is a pain in the A. Discharging a prisoner is a little tricky, okay, because when you're discharging them, well, if they need to go to infirmary, if they need continuous antibiotic, they need to feed, or they need wound care, these prisoners will have to stay in the infirmary. But if the inmate will stay in their cell, it's okay. You can just discharge them, give them education, but don't tell the patient the time they are leaving or the day they are being discharged, even if it's the same day. Okay, it's just a part of the no-nos when discharging an inmate. And then your nursing responsibility is to call that infirmary where the patient or the inmate is going. Same thing with the sniff. Did I tell you need to call a report when transferring a patient to a sniff? I'm sorry if I forgot to tell that when I talk to you about discharging a patient to sniff. Okay, so every time, so this is what you need to remember. Every time you are discharging a patient aside from home, their own home, you need to call that facility to give them report. So how is the structure? What is the structure of the report you need to give to that person who will receive a patient from your facility? I think we need a different vlog for that. Okay, this is becoming a lengthy blog already. Next, discharging a patient through direct admit. Let's say, for example, your facility does not have what the patient needs, okay? And this is the only time that you are discharging a patient directly to another hospital. Okay, let's say, for example, our hospital, we don't have I think we have a neurologist, but we don't perform neurosurgery. Okay, so we have to move a patient to a hospital that performs neurosurgery. So that's one of the cases that you need to move a patient from one hospital to another hospital. You cannot just transfer a patient from one hospital to another just because the patient does not like the care in your hospital. They can go AMA or they can be discharged, but you cannot transfer them from hospital to another hospital if they don't like the care. It has to be because your hospital cannot provide the specialty that the patient needs. Okay, your nursing responsibility, there's not a lot. You can keep the patient's IV, like IV site or the PIC line, and you don't have to give report to the receiving facility because a direct admit is a doctor to doctor report. So you don't have to do anything. Just educate the patient, give them the medication they need to take on that time if they are due for anything, and you could transfer the patient. Let me just emphasize that if a patient needs to be transferred to a different facility, a transportation is important, okay? And that transportation is either one arranged by the receiving facility, so you as a nurse has to make sure that you know who is arranging the transport for that patient. They usually give you an ETA or expected time of arrival. Let's say, oh, this patient's transportation is arranged from 8 to 10. So it's already 10 o'clock at night and transportation is not there yet. So at least you know who to call or who to follow up, okay? And did I tell you why is it a pain in the ass to discharge a patient to a prison system? Because if the patient's transport is not there at 7 p.m., the patient will not be accepted by the infirmary or the jail system. They don't accept patients after 7 p.m. or at least that's the case here in Phoenix, Arizona. Okay? Well, there you have it, guys. Thank you so much for watching today's episode of Pinoy Nurse Portal. And by the way, this episode is dedicated to my #1 fan / follower from Peoria, Arizona, Ryan Argame. Thank you so much for watching my vlog. And to you guys, if you are not a subscriber yet, please don't forget to like, share, and subscribe. See you on my next vlog.